Hi all, I'm Dr. Malati working as a professor in Tripoli College of Nursing. So in this video, I'm going to discuss about the Partograph. The objectives are introduction, definition, purposes, principles, articles, components of Partograph, summary and conclusion. Introduction. Partograph, it is a simple graphical chart used to monitor the progress of labor and the condition of the mother and fetus. So it is considered as a tool where the nurses should maintain during the first stage of labor for all the mothers who is undergoing the labor process. So actually it is recommended by the WHO for the safe labor management. So we will be recording Partograph. The components mainly we are recording in the Partograph are cervical dilatation, fetal heart rate, uterine contraction and maternal vital signs. So the Partograph helps in early detection of prolonged or obstructed labor and ensures timely intervention, thereby reducing the maternal and neonatal complications. This is a WHO modified Partograph where we'll be start marking the cervical dilatation from 4 centimeter. The definition for Partograph is, it is a composite graphical recording of cervical dilatation and descent of head against duration of labor in hours. It also gives information about fetal and maternal condition that are all recorded on single sheet of paper. Purposes are to assess the progress of labor, to provide detailed of necessary information, that is parameters of maternal and fetal well-being and labor progress, to predict the deviation from the normal duration of labor and to take the necessary action in case of prolonged labor. So when we will be saying predicting deviation from the normal duration of labor means when the progress of labor crosses the alert line, and if it is moving on towards the action line means it is deviating from the normal way, and we can able to find the duration of hours, means the labor which is taking place for the mother. So for the primigravida mother, usually 12 to 16 hours is the normal duration, and for the multigravida between 6 to 8 hours. When it goes beyond this duration and if the labor process is not progressing means we can able to detect it is deviating from the normal pathway, and necessary action also we can able to take. The principles are, the Partograph is a valuable tool to assess the progress of labor. It is useful to detect deviation from normal such as abnormal progress, fetal distress and maternal exhaustion. It is designed for recording the maternal identification data, fetal heart rate, color of amniotic fluid, molding of the fetal skull, cervical dilatation, fetal descent, uterine contractions, oxygen administration, IV fluids, maternal vital signs and urine output. Partograph reading to be started when the labor is in active stage. So as I told you earlier, in the new WHO modified Partograph, we will be starting from 4 centimeter cervical dilatation or above. Other principles are cervical dilatation, descent of the fetal head, uterine contractions are used in assessing the progress of labor. So about 1 centimeter per hour cervical dilatation and 1 centimeter descent in 4 hours indicates good progress in the active first stage. Followed by FHR, uterine contractions can also be recorded every 30 minutes if they are in the normal range. Followed by assessing the cervical dilatation, fetal descent, color of amniotic fluid and the degree of molding or caput every 4 hours has to be noticed. Then we can perform a digital vaginal examination immediately if the membranes rupture and if you have noticed the gushing of amniotic fluid while the woman is in the stages of labor. So FHR, when it goes below 120 per minute or above 160 per minute for more than 10 minutes, it is an urgent indication and that has to be bring it to the notice of physician unless labor is progressing too fast. Immediate reference to physician is required in cases where the cervical dilatation mark crosses the alert line Molding is 3 plus with poor progress of labor, and if amniotic fluid is lightly stained in latent first stage or moderately stained in active first stage or thick meconium stain in any stage of labor, it has to be bring it to the notice of physician. And coming on to the latent phase of labor, make sure that it should last no longer than 8 hours. These are the principles in Partograph. Articles: vital signs tray, per vaginal examination tray, medication tray, Doppler with jelly and cotton swab, Partograph, and 3-color pen, pencil and scale is needed. Next is components. It focused on assessment of fetal well-being, assessment of maternal well-being, and assessment of progress of labor. The components are on the top of the Partograph. The first and foremost, we are supposed to mark the identification section, which is nothing but the baseline data of the mother. So it consists of name, age of the mother, gravida, para, hospital registration number, date and time when she got admitted to the labor room, time the fetal membrane ruptured. Next section is the graph section. It focuses on the FHR. So the FHR scale, it ranges between 60 to 200 beats per minute. So during the second stage of labor, if the liquor contains thick green or black meconium, the fetal heart rate is counted and recorded every 5 minutes. So each square fetal heart rate on the Partograph, it represents 30 minutes. So this is an image of fetal heart rate where it starts from 80 to 200. Next part is a liquor and molding. So molding is nothing but it is a overlapping of the sutures during the progress of labor. So here the rows placed below the FHR. So in the previous slide I have shown you the image of FHR, the components which comes in the Partograph. So underneath the fetal heart rate, there are 2 rows where you are supposed to mark the amniotic fluid and molding. So molding, which is nothing but the overlapping of the suture during the labor process. So the rows placed below the fetal heart rate section are to be recorded like the membranes, whether it has been ruptured or not, we will be writing this on the top of the Partograph, and molding of the fetal skull. So how you will write the membrane means it has to be represented in the alphabetical letters. So I means membrane is still intact, it is not ruptured. A denotes membranes are ruptured and liquor is absent. C denotes clear liquor. B denotes blood stained liquor. So in this box, in the square, you can mention either A, I, C, B. Underneath this amniotic fluid, molding. So molding can be represented in the form of 0, +1, +2 and +3. Next is molding. I told you, molding denotes the extent to which the bones of the fetal skulls are overlapping each other as the head is forced down the birth canal. So the degree of molding has to be recorded every 4th hourly. So this can be detected by doing a per vaginal examination. So molding is recorded in the Partograph as degrees 1 to 3. So as I told you earlier, 0 indicates no molding at all. Bones are separated, sutures can be palpated easily. +1, sutures are opposed here, skull bones touching each other but not overlapping. +2 denotes one skull bone is overlapping another, but when pushed gently, the overlapped bone goes back to its original state. +3, one skull bone is overlapping another, but when tried to push the overlapped bone, it does not go back. So it indicates that the labor is at increased risk for becoming obstructed. Next component is dilatation of the cervix and descent of fetal head. So dilatation of the cervix can be represented in centimeter in the X form, and for the fetal head, fetal head is nothing but descending, means moving towards downward direction, and it has to be represented in the form of 0, O, that has to be shaded. So the portion of the Partograph labels cervix in centimeter and marked S for recording the cervical dilatation. So that is the diameter of the cervix in centimeters. So our next portion of the partograph is descent of the fetal head. That has to be marked 0, means O, which denotes how far down the birth canal the baby has progressed. So the measurements are marked X and O every 4th hourly. There are 2 rows at the bottom of the section of the partograph to write the numbers of the hours of monitoring the labor and the time on the clock. So this is the image of marking a cervical dilatation. So there are 2 components you are supposed to mark here. One is cervical dilatation, another one is descent of the fetal head. So the cervical dilatation, it will start we are supposed to start marking from 4 centimeter and it has to move towards the upward direction. Whereas the descent of the fetal head will come in the downward direction. So on the farthest end of this centimeter cervical dilatation, the farthest line, you should mark the descent of the fetal head, saying that straight to the end point of the 10 centimeter cervical dilatation, you have to mark as -5. Straight to the 9 centimeter cervical dilatation, you have to mark it as -4. For 8 centimeter, you will mark it as -3. These things representing the descent of fetal head. So how it will be representing means -5, -4, -3, -2, -1, 0. 0 is a station at the level of ischial spine. Next followed by +1, +2, +3, +4, +5. So +1 is below the ischial spine. Okay, +4 and +5 and all rounding will be taking place. So on either side means this side will be, it will be representing the cervical dilatation. Farther side we will be mentioning the descent of the fetal head, but both the things should marked in the single line. So under this you can able to see hours and time, where you have to mention the timings, what time the PV has been done. Okay, so that time exactly straight line you have to mark both the cervical dilatation as well as the descent of the fetal head. Alert line and action line. So you can able to see 2 lines in the partograph. So usually we will be starting from the alert line. So alert line starts from 4 centimeter of cervical dilatation and it will be traveling diagonally upward towards the point of expected, that is full centimeter cervical dilatation, which is nothing but 10 centimeter. So usually 1 centimeter cervical dilatation per hour can be expected. So the action line is parallel to the alert line and 4 hours to the alert line. So these 2 lines are designed to warn the nurse or midwife to take action quickly if the labor is not progressing normally. If the progress of labor is satisfactory, the recording of cervical dilatation will remain on or to the left of the alert line. So this is an image of the descent of the fetal head, where you can represent in the form of 0, 5, 1 by 5, 2 by 5, 3 by 5, 4 by 5 and 5 by 5. So 0 by 5, which is nothing but none of head is palpable. So by doing a pelvic palpation, you can able to elicit how far the descent of the fetal head has taken place. So 1 by 5 denotes sinciput you can able to feel, occiput not felt. 2 by 5 is sinciput felt, occiput just felt above the pelvic cavity. Okay. Then 3 by 5 sinciput easily felt and occiput also felt. 4 by 5 means sinciput high, occiput easily felt. Then 5 by 5 means completely above the pelvic brim it is. Coming on to the uterine contraction. So uterine contractions, it has been represented in the 3 ways, that is mild, moderate and severe contraction. So mild, it has to be represented in the as a dot inside the square box, and for the moderate you have to draw a diagonal line, and for the severe contraction you have to shade it darkly with the help of your pencil. So uterine contraction are recorded every 30 minutes. The scale is numbered from 1 to 5 contractions per 10 minutes are recorded. Each square represents 1 contraction, so that if 2 contractions are felt in 10 minutes, 2 square need to be shaded. So I will show you the image of the uterine contraction. So this is what I have told you. So mild, moderate and severe. There are three type of contractions are there: mild, moderate and severe. So mild, when you will say it is mild means, so when the mother gets the contraction, you have to place the hand over the abdomen and look into the watch for the seconds. So if the seconds falls into the category between 1 to 20 means it is called as mild contraction. If the seconds goes beyond 20, that is 21 to 40 means it is considered as moderate contraction, and 41 to 60 it is considered as a severe contraction, and it has to be represented like this, the image which I have shown here. The dot is mild contraction, diagonal line is a moderate contraction, and dark shading you will call it as a severe contraction. So this is the image in the partograph. So you can able to see a 5 square in each line. Okay, so every 30 minutes you are supposed to mark, and for the every 30 minutes the type of contraction the mother perceived. If it is mild means how many mild. So say for an example, if a mother is within a half an hour duration, if a mother is having a 2 mild contraction and 1 moderate means, the first 2 boxes you are supposed to mark mild contraction by putting a dot inside the square. Then moderate contraction means in the third one you should mark a diagonal shading. So it represents the moderate contraction. So this is how you are supposed to mark the contraction chart till the mother delivers. Coming on to the oxytocin. So under the contraction, the medications and the IV fluids the mother receives have to be returned here. So oxytocin, there are 2 rows regarding administration of oxytocin during labor process, and the amount we are giving, the drops per ml, how much you are increasing. Everything you have to mention it in this box. Under this oxytocin, drugs and IV fluids, if a mother gets any kind of medications, sometimes the mother will vomit during the labor process. If any medication she receives, so that has to be mentioned, and IV fluids given to the mother, that has to be recorded in this lump sum. Coming on to the maternal well-being. So here it is assessed by measuring the mother vital signs: blood pressure, pulse, temperature and urine output. Pulse is recorded every 30 minutes and temperature every 2 hours. So here temperature, you can able to see the pulse, blood pressure. So pulse and blood pressure you have to put a mark and draw a graph. Then for the temperature, if it is normal you can mark it as N, otherwise you have to specify inside this box. Next, last one is a urine output. It has to be recorded every time urine is passed, and any deviation. Suppose, say for an example, if a mother is a PIH mother and if she is having a pedal edema during the first stage of labor due to the contraction, there is a chances of shooting up of blood pressure. Okay, so we'll be collecting the urine and we are supposed to send it to check for any proteinuria, acetone, and the volume. So if it is present means immediately we have to ship the mother for the cesarean section. Otherwise the complications may arise. Summary: the partograph is a graphical tool used to monitor the progress of labor and the condition of the mother and fetus. Recommended by the WHO, it includes the assessment of cervical dilatation, FHR, uterine contraction, descent of head and maternal vital signs. The alert line and action line helps the healthcare providers to identify the abnormal labor progress and to take timely decisions. It is simple, low cost and effective method for preventing prolonged and obstructed labor. Conclusion: the partograph is an essential tool in labor management. For nurses, it plays a vital role in early detection of complications, timely intervention, and improving the maternal and neonatal outcomes. Proper knowledge and accurate plotting of the partograph ensure safe, systematic, and quality intrapartum care. References. Thank you.